If you're a teenager struggling with painful periods or a mom watching this because you're worried about your daughter, I want you to hear this clearly. Period pain is treatable. You do not have to suffer every month. Severe period pain isn't a personality trait. It is not something you build tolerance for. It's a medical symptom, and we have science based treatments that can help. I'm Dr. Siva. Let's talk about dysmenorrhea and endometriosis today. Painful periods can be caused by normal hormonal changes, but they can also be a sign of conditions like endometriosis, adenomyosis, fibroids, or pelvic inflammation. So, the earlier we treat the pain, the better it is for your long term health. Let's start with what we can do right at the GP surgery or primary care. The first things are the anti inflammatory medications, NSAIDs, which reduce the prostaglandins, which are the chemicals that trigger the spasm and then the cramping during the pain. The prostaglandins also cause body aches, knee joint pain during the periods. So you need to take these medications, ibuprofen or naproxen or mefenamic acid, just before the period start and during the time of periods, and it can dramatically reduce pain in many. If this is not helping, the next step is the hormonal pills. The hormonal pills are not just contraceptive pills. They are estrogen and progesterone combinations or progesterone only pills which help to reduce the ovulation pain and also calm down the period pain. So they are licensed to treat heavy painful periods. Mirena coil implant also help with these ones, and these are absolutely safe for teens and young adults when prescribed appropriately. I definitely would suggest pain mapping. Pain mapping means tracking the symptoms to help understand the pattern of the pain. There are a lot of apps for these. Whether the pain starts before the bleeding or long before, whether it affects the bowel or the blood. It is very crucial, these pain mapping, to know what the pattern is. Let's talk about the test because many teens are never offered them. First thing is the pelvic ultrasound, which is the first imaging test. It can detect ovarian cysts, endometriomas, fibroids, and structural issues. Blood tests, these don't diagnose any endometriosis, but the blood test can help to rule out anemia or thyroid issues which cause heavy periods. And if there is PCOS, the hormonal imbalance causing irregular periods, then blood tests are useful, but not for the pain. Pelvic pain can sometimes be caused by infections. That is why sexually transmitted infections need to be screened in sexually active teenagers and young adults. MRI is a very useful tool to find out endometriosis. So, MRI with contrast is usually done by the gynecologist of the hospital to diagnose endometriosis and its severity. So, if your pain is severe, getting worse, and not responding to first line treatments, that's when we involve the gynecologist. That doesn't mean something is wrong with you, it means you deserve specialist care. So, a gynecologist can offer beyond the pelvic ultrasound that can be done and the blood test done in the primary care. In secondary care, they can give advanced hormonal options, assessment for endometriosis and adenomyosis, like the pelvic MRI, and referral to specialist endometriosis centers for surgical evaluation if the endometriosis is worse. What teens need to hear is your pain is real, you're not being dramatic, and you're not meant to push through every month. So, if your period pain stops you from living your life, like attending school, sports, events, having friendship meetings, sleepovers, that is a medical reason to get help. I want moms to hear this. If your daughter is missing school, curled up on the floor, vomiting, fainting, taking painkillers constantly, that is not normal. That is a sign she needs medical support. Ask help and ask early. Let us be endometriosis aware. Stay tuned for more medical information videos.